Welcome to my YouTube channel, Alfred Atanda, MD, where we discuss hot topics in orthopedic surgery, sports medicine, telemedicine, and other digital health innovations, and vlog about day-to-day life as a physician. Please enjoy the next video, and don't forget to like, comment, and subscribe to my channel. Thanks for joining me on this ride on a typical work day, going down from Philadelphia, Pennsylvania, down to Wilmington, Delaware. It's usually a straight shot down 95 South. Takes about 45 minutes, depending on traffic. As you can see, there's not a whole lot of traffic this morning, which is really awesome. You can see the sun's starting to come out just a little bit as we pull into the parking garage. So I just pulled into my parking spot. It's 6:27. It took about 40 minutes to get here. And now I am ready to get out and start my day. I gotta leave the parking garage and head down through the employee entrance into the hospital and make my way over to our faculty meeting. It starts at 6:45. Got a couple things to do before then. But that's where all the attending physicians and the doctors in charge will get together and talk about strategies for the department, talk about how to take care of our patients best, talk about different ideas and initiatives to help increase revenue and money that we generate and all. So it's once every other week typically, and all the attending physicians, doctors in charge are supposed to be there. So I'm doing my due diligence and I'm showing up. So I'm walking down the hall, heading towards my office. Gotta drop my stuff off and get ready for the day. Gonna try to get a good seat at the faculty meeting. Looks like I'm the first one at the faculty meeting. It's just a conference room, basically. You can see there's multiple chairs, kind of like a boardroom style feel. This will be packed in about 15 minutes with all of our doctors, nurse practitioners, physician assistants, just talking about the week's events and how we're going to improve what we're doing. I'm heading over to the main clinic area where I'll be seeing patients today, where patients mostly come to talk to the docs, talk about surgery, talk about their problems, and just update us, not really have procedures like they do over in the cast room. This is our clinic space over here. We got 6 rooms, basically each identical. Come on in here to this one, cut the lights on. You can see we got an exam room, we got a sink, we got a workstation, have otoscopes, ophthalmoscopes. We don't really use those in orthopedics. Those are devices to look in the ears and noses and eyes of kids. We got waiting area for the parents to sit and ask questions. This is where the bulk of the work happens, especially in pediatric orthopedics. Most of what we're doing is counseling families, counseling scared children, talking about their injuries. So there's a lot of talking that goes on, believe it or not, even though we're in surgery. But we need a nice, clean facility and space to do that. And it's pretty early yet now, but this place will be jumping in a few hours with patients and docs and team members. So I'm here in the clinic, just getting ready for the day. We have about 18 patients scheduled so far, between 8 and about 4:30. We actually do telemedicine or virtual doctor's visits also. So I just completed one, started at 7:45, and I just finished now. So that patient actually wasn't here. They were still at home, but we do those visits like kind of like a Skype or FaceTime interface, so we can see them and give information and such. But they don't necessarily have to be here, so it saves them time, it saves them energy. And my staff isn't burdened with that patient because I just did it myself, talking to them, kind of like I'm talking to you all. That's been a big hobby of mine lately, but now all the in-person real traditional visits are going to start. So I got to get geared up for that and try to push through and get ready for lunchtime at noon. Good afternoon, everyone. It's about 12:05, sitting outside, catching a nice breeze, getting a little bit of sun. Just finished my morning clinic, saw about 9 patients, and afternoon we'll have another 10 patients or so that we got to get through. So I'm a little lucky. I get about an hour or so to sit out here, eat my lunch, catch up on a little bit of rest, check some email, and we still got a lot to do yet. So I want to make sure that I can bring my A game and get through all the patients and get them what they need, obviously, but make sure I'm nice and energized. So lunch is definitely necessary. Sometimes you got to work through lunch, and you may have to even skip lunch, but I definitely don't recommend that. But today's a lucky day. I do get a little bit of a nice meal before I have to go back and tackle the rest of the patients. My lunch is healthy as possible. I got some chicken nibblers, I got some penne pasta, got some grapes, and I got some water. It's not always as balanced as this, but I try to pack my lunch today and make sure I eat as healthy as possible. And that's always key to being able to work hard and get through the day. Well, I survived another day. It's 5:25 in the early evening. Just finished my afternoon clinic and got back to the car here. Saw another 9 or 10 patients or so. I think a couple got added on. Little bit of a disappointment. Didn't sign up too many surgeries today. I think we signed up one kid who was a lateral meniscus tear or a cartilage tear in their knee, and then another kid who has a ligament tear, the anterior cruciate ligament tear in his knee. So we signed up 2 kids for surgery this whole day out of about 18 kids. We like to keep those odds and that ratio a little bit higher, but you know, that's the life of a surgeon. You win some, you lose some. But got to get back in the car, get on the road. Got another 45-50 minutes of Delaware Valley traffic ahead of me. I'm actually on call today, so what that means is an attending. Luckily for me, I do get to go home, but if something needs to be done or somebody needs surgery, the residents and the fellows who are in the hospital will give me a call, send me the x-rays, and I may have to go back and take care of that this evening. We do have another attending surgeon or a doctor available tomorrow to clean up any spillover surgeries that come in overnight, but if there's anything that's urgent, I will have to make that 40 or so minute trek back here. So I'm heading home. I'm going to try to get something to eat, get a little bit of rest, and we'll see what the night brings. Thanks for hanging out. I hope you enjoyed this video. Please tune in for more videos in the future. Have a good day.